Samburu County is a county that has a population of about 227,000 people. 28% of the people in Samburu are actually not literate. We have implemented programs using mass media, radio, TV, we have used print media, we have used phones, and we've always had this gap, and we have tried to explore what we can use to fix this gap. When I went to the Addis Ababa SBCC Summit, I saw the talking books. I knew this is the gadget we've been looking for.
Kawal na bang kitabu nya kata yoltu na kata nugo na isom na bama na kitabu na ko na tatu mo na disomo mo guro na go amu intaranya na ga ni te berno go na ni ne na ga pokin nati.
Only 6.2% of the households have electricity. The talking book comes in very handy because you don't need electricity, uses battery. You only use audio, therefore you can use local language to communicate to the community. So it bridges the gap fully. In the county, we have about 46,000 women of reproductive age. And out of this 46,000, only 18% deliver in a hospital. We have only 58 facilities, health facilities in that whole population. It means the facilities are far. So it becomes so crucial and critical to have an intervention like the Talking Book program. We did a formative assessment, and from the formative assessment, one of the key issues that emerged is that we have a lot of misinformation and also knowledge gaps in the community. We developed information and recorded this information in local language in the talking books to address these gaps and the barriers and the misinformation. We have managed to train 94 community health volunteers, and we have given them the talking books. We have several community units. When they meet on a weekly basis, they are supported by a community health volunteer who educates them, who helps them to understand and listen to the talking book and use the visuals that they have been given. They go through one topic in a week.
Alafu ni hata na kitabu sapuk na hata kulodo ngana akona kitabu nikuni.
The thematic areas that we have include family planning, reproductive health, child health, maternal health, nutrition, as well as water and sanitation. These 94 community health volunteers that we have already trained have reached over 1,630 beneficiaries. And we of course have a total and a target of the entire women of reproductive age, that is 44,000.
Initially, before the Digisomo introduction, we had few antenatals for ANC visit and few deliveries in our facilities. Now when it has been introduced in the community level, the CHVs are now able to give the same information, the same content that we taught them, without alteration.
Karaba yolo ko patana te tangkang itiagi shunto mono na korna da igu na da na anna to bina da mata jo korna gi igu na da igu na ga yeli sugole ni na ko na ata na da hospital na da ko angara ke igu na da ke saidi di yo leng na ngara ke terina da itu community.
We used to get an average of 19 deliveries per month, and now it has grown up to around 27, average of 27 deliveries per month.
We have antenatal visits, what we call ANC visits. These visits were just at about 34 mothers in a month, but currently that has increased to 70 mothers in a month. That's over 100% increase. On a monthly basis, we load a thematic area, so that they finish and understand those key messages, and then we add more and then also look at the statistics and analyze.
We extract that information using the USB cable so that we're able to get the data that they have used for the period of the deployment. That data is then uploaded into the Amplio website, where they do the analysis, they process that data, then send it back to us in form of a report.
We are quite grateful for the support. We are thinking that if we're able to scale up within the county, reach out to all those 1,000 community health volunteers so that they're able to cover all their households, and even scale up to other counties that we are working in, we'll have much greater results, good health outcomes, and the health of the mothers and the babies will be restored, and we will save lives of mothers and lives of children. You can imagine if we didn't have the program, what would be happening? We would still have maintained the position where we were in. Few mothers would understand the consequences and continue to deliver at home. Amplio has been of great help to the team in Kenya, both in provision of talking books as well as building our capacity to implement the program and continuous support.
Waramatio tisho yanga ngenye wasisho walgitarni tonobo motu mongaralda wa ile clinic motu mongaralda wa ile clinic peye motu moyana tuwa na polio korenga ngoni shona la ngoni waramatio tisho yanga ngenye